Hi, everyone. We're three clinical psychologists coming to you to talk about mental health and wellness and provide some education to the general community. My name is Dr. Catherine McKay. I'm a licensed clinical psychologist, and I'm licensed in both New York and Florida, and have a private practice in St. Petersburg, Florida. My areas of specialization are trauma, specifically PTSD, and the treatment of couples. Lesia, you want to
Hi,
introduce yourself?
everyone. Yes, thank you, Catherine. My name is Dr. Lesia Ruglass. I'm a licensed clinical psychologist in the states of New York, New Jersey, and Tennessee. I'm also a Florida telehealth provider. I've been practicing in the field of psychology for over 20 years now, and my areas of expertise include the assessment and treatment of stress, anxiety disorders, post-traumatic stress disorder, and substance use disorders. And I'm thrilled to be here.
Thank you, Lesia. I'm Dr. Nathilee Caldeira. I'm a clinical psychologist licensed in New York and New Jersey. I am the founder and director of Let's Talk Psychological Wellness here in New York City. We are a group private practice that we specialize in treating anxiety, panic, trauma, PTSD, and alcohol misuse. Very excited to get this started.
Yeah, so, we wanted to do this episode and actually a series of episodes because we are in unprecedented times as a country due to the mass trauma of COVID-19. As of this recording, May 23rd, 2020, there have been close to 1.6 million confirmed cases of COVID-19 and over 96,000 COVID-related deaths. New York and New Jersey have been particularly hit hard by COVID-19, being the number 1 and 2 states in terms of the number of COVID-19 related cases. We know that racial ethnic minorities, particularly African Americans, Latinx, and Native Americans, are dying at a higher rate than other subgroups, and that's hard to see. So we really wanted to come together in this episode to talk about mental health, mental well-being, and how to cope. And in this episode, we are going to be talking about what is anxiety, how do we know when anxiety is normal or not, how might anxiety look different in people of color, and what are some of the factors that might increase the risk of anxiety for people of color, and what are some effective coping strategies for coping with anxiety.
Yeah, so let's get started. Lesia, can you tell us what is anxiety and when does it become an anxiety disorder?
So anxiety can manifest in a lot of different ways. Often it can feel like it comes out of the blue, out of nowhere, but we know that when you can tease apart the ways in which anxiety manifests itself, the different components, then you can feel a greater sense of control over this emotion. And the one thing I wanted to just highlight is that it's understandable that we're seeing this rise in its stress and anxiety because we're all having to deal with COVID-19. So learning more about how to understand what anxiety is, what the components are, is a first step towards helping you to manage more effectively. So there are 3 components to anxiety. The first is the emotional and the physiological component, so how you are feeling internally. Emotionally, you may feel nervousness, irritability, restlessness, shortness of breath, heart palpitation, muscle tension, sweating, difficulty sleeping. There are also cognitive components, what we call anxious thoughts or worries. For a lot of people, the worries are something bad might happen to themselves or to their loved ones. Will we get COVID-19? Will they lose their job? Will their partner leave them because they don't have a job anymore? And then there are behavioral components of anxiety. Anxiety may show up in your behaviors when you avoid doing things or going somewhere because you're afraid something bad might happen. Now, we know that there's good avoidance. We know that there are things that we can do to protect ourselves from getting COVID-19. So wearing a mask and using hand sanitizer or washing our hands, making sure that we're physically distancing. But on the flip side of that, when you find that your anxiety is getting overwhelming, that you're experiencing it frequently, and that it's causing problems in your day-to-day life, then it's possible that you may have gone into the realm of developing an anxiety disorder. What are your thoughts on that, Catherine and Nathilee, the three components of anxiety?
Yeah, I think you've done a wonderful job explaining that. And I especially like your emphasis on there's this line between protecting ourselves, doing things that are mindful of what's the risk, but also it can lead to a place where people start kind of their lives are impacted greatly by the anxiety of this.
And I think that it's a really great layout of, of answering the question, what's normal anxiety? What's abnormal anxiety?
Yeah. When we look at it, for us, to recognize that there are some particular things that people of color may experience a little bit more, in addition to those things. So the backdrop of racism and discrimination are still in existence while we're dealing with COVID-19, right? So if I'm aware of the fact that, I can be targeted or be unfairly treated because of my race, that adds to my overall anxiety.
That's a great point, Catherine, which brings us to our next question. How might anxiety look differently in people of color?
Well, I think for people of color, specifically African Americans, that there's historically been a belief that we can just kind of keep on going. The acceptance of pain and struggle as a normal part of life, commonplace for us, has really helped to set a mindset of resilience. We push through, we make sure that we do what we need to do. And we even think sometimes that psychological or emotional issues may be a luxury. Like, we don't have time for that. We need to keep going. And unfortunately, that resilience, while it's really wonderful in terms of our survival, it can also set us up for a higher incidence of anxiety related issues that may come out sideways. What we do know is that if we're not able to label the anxiety, deal with it, and as you said, be aware of those other ways that it shows up emotionally, it starts showing up physically for us. And in the physical manifestations, we have heart disease, higher risk of cancer. It can impact us in terms of GI functioning. It lowers our immune system, right? And during this time of COVID, where everybody wants to make sure they're as healthy as possible to protect themselves, you do not want to compromise immune system. So those are the ways that it can really show up for African Americans. And then, as I said, the other component that's really important to know is that racism in general and discrimination, being people who have been oppressed in society, increases our overall anxiety. So there's a greater likelihood that my scan, my radar has to be on all the time to make sure that I'm safe. That added to the anxiety around COVID just increases the risk factors for people of color.
You bring up some wonderful point, and one piece that I heard that I wanted to highlight in particular is this idea that it might be seen as weak to acknowledge these feelings of anxiety and stress. I know for a lot of Black women, there's this idea of the strong Black woman that, and understandably, we know where that idea comes from, right? Because the Black woman has had to do a lot for the family as a whole. She has been the backbone of the Black African American families. So we know where that schema comes from, but we know that when you suppress your emotions, when you don't allow yourself to express what it is that you're thinking or feeling, or talk to somebody about what you're going through, that can lead to other problems, as you mentioned, physical health problems, psychological problems. So I think it's important to also be thinking about, well, what are some effective ways to manage all of the anxiety that we've been talking about? Nathilee, can you say a little bit about that?
Sure. And I really wanted to talk about this with you guys. We have been working together for a very long time as colleagues, and we've worked on a very important project together, needs assessment for the University of Guyana. And one of the things we highlighted there was a shortage of mental health professionals.
Right.
But we also know that this is not just in Guyana or the rest of the Caribbean, that there is a shortage and a access issue in the United States as well. There's a shortage of mental health professionals, and there's many challenges in access. So we are excited to do this and take this opportunity to talk about some strategies today. So we highly recommend that everyone increase coping strategies at this time. So not only to manage through the current crisis, but to buffer against the long-term effects of all of the sustained uncertainties that we're dealing with. Death, loss, job insecurity, financial insecurity. We're all adjusting to many changes in our personal lives, our work lives, and community. We want to go back to the basics. So, practicing sleep hygiene. This is going to, help you really manage some of the things that you have to deal with. So, keeping a regular bedtime, turning off your devices maybe 2 hours prior to bedtime, reducing alcohol use, watching the news early in the day, preferably once per day, keeping a notepad at your bedside to write down the things that you're worrying about. Unless it's an emergency, this is something you can deal with tomorrow after you've had some sleep. Nutrition, back to the basics of hydrating regularly, adding more fruits and vegetables to your diet, exercising more, simple things like stretching, walking more regularly if you're not doing this already. When coping with anxiety, we want to be aware of how anxious we are getting. One way to practice is to measure anxiety on a 1 to 10 scale. So this awareness alone can really help reduce our anxiety. And then we can be aware of when it's rising to panic levels and help to practice training our brain how to cope with that, how to manage, how to be more in control of our anxiety levels.
I love that. And
Nathilee.
having, yeah, that
Yeah.
1 to 10 is a wonderful way to measure that, and recognizing that, when I'm getting up there, I'm at a 7, and maybe that danger zone that it's going to go really quickly, 7, 8,
Yeah.
9, 10.
Yeah.
But being able to be aware of that helps us. Lesia.
Definitely. Studies show that when we're able to be mindful of and name our emotions, it allows us to step away from the emotion. So the ability to say, I am feeling anxious right now, to name the emotion. And then also, how anxious am I feeling on a scale of 1 to 10? If I'm feeling at an 8, that means I'm feeling anxiety pretty intensely. And then I want to be thinking about, okay, well, what do I want to do about this anxiety in terms of coping? And so that is the first piece, the awareness. How am I feeling? How strongly am I feeling this? And then what do I want to do about it?
I think that's wonderful. And one of the things that you mentioned, Nathalie, that I think it's so important is sleep, right? So
Yeah.
sleep is like essential for our functioning. It impacts our immune system when we don't sleep adequately. It impacts our psychological functioning. So the fact that that's one of the things that we really want to make sure people are paying attention to.
And so when we make these suggestions, great suggestions, we find that a lot of times we get questions about, well, it's easy for you to make these suggestions. How can we practice and maintain some of these habits that we know can be helpful? Because we know that practicing good nutrition, exercise, sleep can be challenging, even though it sounds very simple to do. Any thoughts?
Definitely. Yeah, I mean, first I would say change is hard. It's hard to change when you've been functioning in a certain way for a really long time. So first, you just want to acknowledge change is hard. And then the second step would be to really identify, well, what are your reasons for changing? Why would I want to improve my sleep or get more exercise or learn how to label my emotions? How will this help me? When you're able to identify what your reasons are for making the change, you can get in touch with your motivations for the change, and that can help move you towards making those changes.
I love that, because what we know is that when we align our behaviors with our values, we're pulled towards them, as opposed to this push, I have to, I should do this. It now is something that, really feels good and it makes sense for me. And being able to just start at the beginning, right? So what's the one thing? What's the smallest thing that you can do? We all have our window. And if we can just add a little bit outside of that, just to stretch ourselves, that's a wonderful place for us to start. So pick one thing, right? Pick, you know what? I may not be able to walk 5 miles. Maybe I can walk 1 block, right? Start wherever you can.
So examining our motivations and taking very small steps. And I would also add that we want to practice being compassionate. When we look at
Yeah.
successful athletes, for example, what we know that leads to their success is that they actually have a coach that is helping them practice every day all of these great habits. They have a coach who keeps them accountable. And so if there's a way we may not be able to afford a coach that can keep us accountable daily, but we know that we can use our community. So your family, your friends, your coworkers, how can we come together as a community to simulate what we know works for creating and maintaining successful habits?
I love that. And we can start
Yeah.
with little things like even our social media, right? So when you talked about limiting the TV you watch in terms of the news, we want to also limit what we do in social media. And maybe this is a positive way we can use it.
Yeah.
You know, put it out there on your Facebook. I want to put this one thing in place, and making sure that we have people in our lives who can really encourage us, like I know we've done together as a group.
Yeah, definitely. Social support is so critical. When we think about risk factors for developing PTSD, protective factors against PTSD, social support has been shown to be one of the critical protective factors that can buffer against developing a psychological problem later on. So I love the idea of reaching out to community, to family members, to friends, to, in addition to helping them hold you accountable, to also just to be able to share what you're thinking about, what you're going through during this challenging time for all of us.
I love that. So if we think about the being aware of what it is that's going on in terms of what you're feeling, and then being able to add in the social support, being
Yeah,
compassionate to yourself,
yeah.
and having that sense of accountability with someone else who can really encourage you with that, those are wonderful things that we can have as a takeaway.
Great. So, people are also wondering, so how are we coping as mental health providers? Like we said, unprecedented times, the mental health providers are going through the same experience as their clients. And so people want to know, how are we coping? What strategies have you been using, Catherine and Nathalie, to cope during these times?
Well, for me, I think first and foremost about that kind of what that check-in, what's going on with me today, like what's
Yeah.
going on emotionally. There may be days that my sleep is not as great as it needs to be, and therefore I may need to be a little bit more tender and compassionate with myself. I try to be really diligent about getting exercise. I'm fortunate to be in Florida, so we have sunshine most of the time, right? So we do get rain. So going out and going for a bike ride or a walk, or having the ability to step out in my garden and see butterflies and take a
Oh,
breath and be
yeah,
mindful of taking a breath.
yeah.
Those have been some of the key things that I've put in my life during this time that I really want to make sure that help me cope overall. What about you, Nathalie?
So I've been going back to basics, practicing sleep hygiene. So every night I have been doing my guided meditations. I practice progressive muscle relaxation, where I tense my muscles and relax every 5 seconds, and also practicing the 4-7-8 breath, which is a wonderful breathing exercise that you can use to reduce anxiety and to help with sleep. I feel like I've gotten, the past 8 weeks, the best sleep I've had in a while. But I also did want to say that in addition, that Lesia talked at the top of the recording about how to distinguish between what's normal anxiety and abnormal anxiety. It's important that you reach out to a professional
Yeah.
if you continue to have persistent anxiety, panic symptoms, as Lesia described.
Yeah,
Yeah. Yeah.
definitely. I mean, wonderful suggestions that you guys are both doing. And I have to say, I do a little bit of all of what you've described. You know, that I try to get good sleep. I try to exercise every day. I get on my stationary bicycle for 30 minutes and watch some sort of comedy to really
Hmm.
shift my attention away from the stress of the world that's going on right now, and have a moment of movement in my life, and some funny comedy as a way to de-stress, talking to friends and family, colleagues like yourself, you know, having the opportunity to check in, let people know how I'm thinking and feeling, that has been critical. I wish I had a backyard with butterflies like Dr. Catherine, and I know for a lot of people in New York and New Jersey who don't have a lot of outdoor space, that we're having to find creative ways to get that fresh air while keeping ourselves safe. So I like that idea of back to the basics. And it sounds like it's been helping us to kind of
Yeah.
do our self-care so that we can be there for our clients in an effective way.
I think that's so important, and knowing that on it's not this kind of rigid thing that it has to look this way every single day, but there's some
Right.
things that we can put in place to really care for ourselves. And I love the humor, because
Mhm.
humor is so important for us to
Yeah.
kind of keep the connection to self and to recognize the places where there may be some things to be grateful for. Yeah.
Yeah. So, as you noted earlier, what's the one thing can, you know, our audience, for them to be thinking about, what's the one thing that they can do to make a change in their life, to implement some of the coping strategies that we've been talking about so far?
I think if people can pick one thing that they can focus on, right? So it may be I'm going to drink more water, and I'm going to set up around my house, a water bottle or glasses, or maybe that I am going to go out and walk for 2 minutes if that's all I can do. Start wherever you can, chunk it as
Mhm.
small as you can. And as we accomplish that, we'll be able to move the bar and set another goal.
Great.
Well, so thank you everyone for joining us, for watching our video today. And we'll continue. Please do check back. This webinar series will serve as a place for discussions around all things mental well-being and health and wellness and support in this challenging time. So stay well and take good care of yourself.
Stay
Stay
safe
well.
and be well.
Yes, stay well.